My name is Kaleigh Backes, and I use she, her pronouns. I am wrapping up my first year of my social work program at Washington University. I chose social work because I wanted to be able to practice with people. And I also think that social work allows you to practice in different areas with people. Before I went to college, we didn't talk about mental health. Psychology was taught more like a pseudoscience growing up, and I got to college and I was not a psychology major, and I ended up majoring in psychology, and I knew that mental health was something that had impacted my life greatly, and I was wrapping my mind around how it had, and I just wanted to learn more about it, and I wanted to help people who had also been impacted by it. So I am currently completing a field placement at Gateway Foundation Corrections, where we work with justice-involved individuals who also have substance use disorders, and it's really great to see the progress that they're able to make towards their goals of both recovery and reentry, while also managing everything that they have going on in their lives and navigating a system that wasn't necessarily designed with their needs in mind. And then in the fall, I will be completing a one-year placement at the VA in their substance use and recovery and rehabilitation unit. And I'm really excited to be a part of the inpatient side of things. It's hard to say when you're in the first year of your program. My plan is to pass my classes right now, but I think that long term, I know I want to work with people who have substance use disorders. My dream is ultimately to take mental health services back to where I'm from. I'm from rural Missouri, southwest Missouri, and mental health access is limited everywhere, but it's especially limited in rural areas. So my dream would be to open a practice there. I think that it's something that we don't talk about a lot, and I think it's something that people are unsure of if people will use, but everyone has mental health difficulties, whether if you're in St. Louis or if you're in a small town. So we need access everywhere. I would like to thank Dr. Philip Murata for his mentorship this past year, as well as the opportunity to work in his research lab. We're investigating how stigma impacts care for people with substance use disorders in rural areas, and hopefully that will inform interventions to improve care. I'd like to thank the staff and faculty at Washington University, as well as the faculty and staff at St. Louis University. I'd have to say I'd like to thank the clients. Right now, it's because of their willingness to be open with me about their lived experiences that I'm able to learn, and oftentimes they do a lot more for me than I'm able to do for them. It's kind of scary to talk about yourself and your interest.